Contrary to popular opinion, which I find often funny too, and even before the implants are placed and designed and in the full arch prosthesis, let's just go to a simple single implant. What I'm finding is even frustrating to me when I see some of these patients that come into us for the first time. What I'm finding is that, yeah, people think we just pull a tooth. Well, sometimes it's just not that simple. There's a technique involved to where you truly want to save all the surrounding bone, as we know, which enhances these implant foundations for the proper engineering. And it really puts us behind when these teeth out there are being incorrectly removed and half the bone comes out with it. Well, now we're forced to build out bone with bone grafting techniques, which takes time to develop these platforms so that we can properly insert implants for our full arch design. And this I find more and more within that population out there of these patients coming to us. I don't know how you guys feel about that, but
I see them all the time with improper angulations, because you place the bone where it is versus maybe putting it where it should go.
The big advantage that we have too is we think with prosthetic driven surgery, and that's the ball's missed on that sometimes with surgical specialists, or sometimes in people who just want to put the implant in, they're not thinking of the end game, which is where the restoration is going to be. And I know all of us, because we talk about it in the office, we're talking about the end game. And when we're placed that implant, we're worried about where those teeth are going to go, or how far that cantilever is going to go back on that hybrid prosthesis. And the end product is in our mind, and we're just not putting implants in bone. And that's the key to long-term success of these dental implants, with stresses, with function and things like that, is where they're placed and why. So I think that's a good advantage that we have.
And once again, diagnosis and treatment planning. It all goes.
I think all roads lead.
It all goes back to that.
Yeah, you hit the nail on the head. We always want to start with the end in mind. Kind of like back to the analogy of the building. We need to know what the final design is going to be before we ever even lay those pilings in the ground. So, and I think that given our team here, we're able to excellently provide that plan and follow through with that on the actual procedure itself, and like we talked about earlier, those maintenance follow-ups to make sure that if and when there does become an issue, we're there to manage it early, as opposed to catching it on the back end when we run into a problem that maybe isn't fixed so easily as it would have been otherwise.
sure.